In this video, I'm going to show you one of the best neck exercises you can do to help with neck pain, headaches, and even a pinched nerve. As well, these exercises can even start the process of correcting a loss of curve in your neck. My name is Dr. Jon Saunders, and I'm seeing more and more people suffering from neck problems that can cause everything from neck pain, headaches, migraines, pinched nerves, disc bulges, even cervicogenic dizziness can come from your neck. Many of these problems can be caused by a lack of normal alignment or a lack of proper motion in the neck joints. One of the most common things we see clinically with patients is not only forward head posture, but a loss of normal lordosis in the neck, or even worse, a reverse curve, which is called a cervical kyphosis. Normal neck alignment when standing up should have a nice 40 to 42 degree curve, just like this. The problem is with our lifestyle, our lack of movement, we sit too much, we don't exercise enough, this curve can be lost. In fact, when it's lost, there's a multitude of things that can happen. It puts pressure on the discs, it stretches the blood vessels, it stretches the nerve, even the spinal cord can undergo some tension. So in this video, I'm going to show you what you can do at home to mitigate, reverse, or at the very least, start the process of correcting a cervical curve to help eliminate neck pain, headaches, and any other potential problem that can be caused by lack of motion or alignment in your neck. Here's my disclaimer. If you have a known spinal condition in your neck, you've had surgery, you've got instability, degenerative disc disease, stenosis, or an acute pinched nerve, these are some conditions that you might want to discuss with your health provider to know if what I'm going to show you is appropriate for your case. If any of these movements cause discomfort or dizziness or an unpleasant symptom, stop immediately and ask your provider if they are okay for you to continue. So for this exercise, you're going to need an elastic band. You could use a rolled pillowcase. You could use this type of tubing. You just need something that's going to give you a bit of resistance. As well, if you've watched any of my other videos, you're going to know that we want to do these in sequence. One and done never works. You can't do one stretch or one exercise or one workout or one healthy meal and expect to get results. These need to be done in a routine and they should be done daily. So please grab your band now. I want you to follow along with me so we can do this together. So to start, we're going to warm up our neck. We're going to do 10 reps twice to get our tissues warm. So we're going to start with our shoulders back, hands on our chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it doesn't matter which order you do them, just do the 10 movements, get the tissues warm so we can get right into the actual exercise. The first thing we're going to do is called the neck pump exercise. So you're going to grab your towel, you're going to grab your band, whatever you have, hopefully something with resistance, and we're going to place it at the bottom of our neck. And the first thing we're going to do when it's placed at the bottom of our neck is we're going to take the towel or the band and we're going to try to get some tension in it, and we're going to stretch forward so it pulls our neck forward. Then we're going to do 3 to 4 pumps in extension. 1, 2, 3, 4. We're going to take it, put it in the middle of our neck, come straight out with our hands. 1, 2, 3, 4. And then the same thing at the very top. We're going to pull up and we're going to go 1, 2, 3, 4. So we can do that 3 sets daily before we move into the next exercise. Of note here, this is not a chin tuck. It's an extension. An extension helps bring some curve back into the neck. Sometimes if we do a chin tuck, it can flatten the curve, which is indicated in some cases if you have deep cervical flexor weakness. But for this exercise specifically, we want to think extension. For the next exercise, we're going to add one more range of motion. We're going to do this, but we're going to do this with rotation. Again, the key here is thinking extension of the neck to promote that natural curve. At the bottom, we're going to extend up and we're going to rotate 1, 3, 3, and then we're going to come back to the middle here, extend up, and then finally at the very top, get it right underneath your occiput and come up. I need to grip this a bit, make it a little bit more tense here. So you should really feel that in some of the muscles at the back of your neck. This is more of an exercise. So you might feel some stretch at the front, but you really want to feel in the musculature in the back of your neck. Now, if you really feel some restriction in your neck when you're doing these exercises, you might want to run through the warm-up or that first series of exercises I showed you. Alternatively, you could click up here. There's a video of me showing you a very good 2-minute mobility neck routine that will help loosen you up. If you have a question or comment, please leave it below. I do my best to answer all your questions. And if you like videos like this, please hit the like button and maybe you'll consider subscribing to my channel. The motivation behind these videos is to help you help yourself in the comfort of your home. For a few other popular videos, click the links here. I can't wait to see you in my next video. Until then, stay well.